Introducing IRRAflow, a next-generation solution for fluid management that uses active fluid exchange to transform how you manage intracranial bleeding. Historically, excess fluid, the collection of toxic material, and increased intracranial pressure have been managed solely through gravity-driven passive drainage, with an external ventricular drain, or EVD. Unfortunately, passive EVDs are riddled with complications of occlusion, ineffective drainage, catheter replacement, infection, and vasospasm. These complications can extend patients' length of stay in the ICU, increasing the institution's overall cost of care. What's worse, an EVD doesn't drain the blood in the brain sufficiently, leading to high morbidity. Given the high complication rate of EVDs, their inability to clear blood quickly, and the elevated cost of care, there appears to be a much-needed improvement in how we treat intracranial bleeding. IRRAflow's active fluid exchange offers a new therapeutic approach to treating intracranial bleeding by combining controlled drainage, automated irrigation, and ICP monitoring all in one system. Automated and controlled irrigation enhances drainage by diluting and helping wash out pathological fluid and minimizes blood or bacteria from collecting on the catheter tip. At the same time, the continuous intracranial pressure monitor controls and automatically adjusts treatment, potentially reducing the risk of complications. As a result, the patient can go home sooner, which significantly reduces the treatment costs. IRRAflow has been used to effectively treat a variety of pathologies, and our early clinical data has demonstrated improvements with treatment time, catheter occlusions, and vasospasms. IRRAflow. Finally, there's a new way to treat intracranial bleeding. Visit us at IRRAflow.com to find out more.